you feeling today?
Pretty good, just feeling a bit overwhelmed preparing for the baby to arrive. There's a lot to think about.
That's totally understandable. There's a lot for you to be thinking about right now. Are you starting to feel more excited as you're preparing though?
I am, just can't wait to meet my baby.
So are there any questions or concerns you brought into clinic today?
I did have one question. A friend of mine is pregnant and she was talking about how she's concerned about having a baby during RSV season, so she wants to get her baby vaccinated. I've never heard of RSV and I'm quite hesitant of vaccinating my baby so early. What is RSV? Should I be concerned in getting a vaccine for my baby?
So RSV is a common respiratory virus. For most adults, it will present as a mild cold, but for newborns, especially those who are born preterm or with chronic health conditions, it can cause serious issues like pneumonia, which is a lung infection, or bronchiolitis, which is inflammation of the lower part of your lungs.
That's scary. And what are my options for protecting my baby?
There are two main options we recommend to clients who want to protect their baby from severe illness due to RSV. The most effective one, which is the first-line option and our community standard for RSV immunization, is an antibody given as a single injection in your baby's leg after they're born. It's an antibody injection, not a vaccination, so it provides immediate protection via antibodies for your baby and reduces RSV-related hospitalization by 81%.
Well, that sounds great, but I'm still a little unsure about vaccinating my baby so soon. We don't really get vaccines in our family, so I'm a little apprehensive.
That's fair. Well, you don't have to worry. The vaccine is recently approved for infants under 6 months, and it's very safe and effective. There are few, if any, side effects, and they're all mild, like soreness, redness, or irritation at the injection site.
What if my baby reacts to it?
So severe reactions are very rare. Studies show that the chance of anaphylactic reactions are 1 in a million doses. If you're still concerned, there is a second-line option for immunity that we offer.
What is it?
So there's a maternal vaccine available for you to get between 32 to 36 weeks pregnant with your family doctor or your public health office. By injecting an inactive portion of the virus, your body creates antibodies that fights RSV, and those antibodies pass through the placenta. This is a process called passive immunity. It's not as effective as the newborn injection, reducing hospitalizations by 57% rather than 81%, but it's a great alternative if you prefer to protect your baby before they're born.
What if I'm not interested in either of those? Are there ways I can protect my baby without a vaccination?
For sure. In that case, we recommend infection prevention strategies. So limiting visitors in the early days, washing hands frequently, and avoiding those who are sick. Also to be aware of the signs of severe respiratory illness in your baby. This includes fast breathing. So if you think your baby's breathing too fast, you count their breaths. More than 60 in a minute is considered much too fast. If you notice that the baby's indrawing their chest, so you can see their rib cage when they breathe in, if they're grunting every time they breathe out, and if their nostrils are flaring. These are signs that your baby's struggling to breathe due to RSV-related illness, and that's a reason to page your midwife or to head into the hospital.
Well, that helps. Thanks for explaining that.
Of course, there are also more resources on the Vaccines and Pregnancy Canada website and the Government of Canada RSV guidelines if you want to do some personal research before you make any choices. So while we're on the topic, I wanted to discuss another vaccination for you based on the blood work we've done. So when we did your routine prenatal blood work, we checked for rubella immunity, and your results came back noting you are not immune to rubella. Based on these results, we would offer you an MMR booster to give after you give birth.
What's the MMR vaccine? What does it protect against?
So this is the vaccine against measles, mumps, and rubella. We specifically test for rubella immunity during prenatal blood work as it's a mild disease for most people characterized by rash, fever, swollen lymph nodes in your neck, joint pain, and conjunctivitis, so that's pink eye. But it's dangerous to have during pregnancy as it has a higher chance of miscarriage, stillbirth, or can cause a series of fetal malformations called congenital rubella syndrome. So congenital rubella syndrome can cause heart disease, cataracts, deafness, and intellectual delay in your baby.
Oh, should I get the vaccine now then, since I'm not immune?
So actually the MMR is a live vaccine, so it's not safe to get during pregnancy. Unlike the RSV vaccine we discussed earlier, which is inactive, the MMR vaccine is live. It contains a weakened version of the virus that triggers antibody production in you without causing an infection. In this case, we would want to discuss vaccination as an option after you give birth to protect from congenital rubella syndrome in future pregnancies.
What if I accidentally get it when I'm still pregnant? Can it cause congenital rubella because the vaccine is live?
So there are studies that show no documented congenital rubella cases from accidental vaccination, but we still avoid it as a precaution as there's a theoretical chance that an active vaccine can cause congenital rubella syndrome.
Are there any risks with this vaccine?
So it's the same as RSV. It may be a different type of vaccine, but the side effects are mild, like soreness at the injection site, mild fever or rash. Serious reactions are again rare, but rubella infections during pregnancy are much more serious than any rare side effects you may get from the vaccine.
Well, since I have to wait until after I deliver to get the vaccine, what should I do to protect my baby now?
So the same thing as before, we advise infection prevention strategies, so you'd avoid communities where there's a known outbreak and making sure you're around family members who are not sick and vaccinated against rubella. Although community rubella cases tend to be quite low in areas where the population is mostly vaccinated.
Okay, got it. I think I definitely want the MMR vaccine after I give birth, but I will need more time to decide on the RSV and do some reading at home. Thanks for your help.
You're very welcome. I'm here to support any decision you may make. If you need more resources or if you have any more questions, don't hesitate to call and ask.
Okay.